Good morning and welcome to the Find Your Peace podcast. I have my friend Hannah Strom here. She is a doctor of physical therapy and the owner and founder of Awake Pelvic Health. So I'm really excited to have her here today. So thanks for being here, Hannah.
Yeah, thanks for having me. I'm excited to chat and dive in.
Yes. So tell me what got you into pelvic health when you were in physical therapy school?
Yeah, it's kind of interesting. I think my journey, like the pieces were in play prior to PT school, and then that was kind of the catalyst. But I never had intentions of becoming a physical therapist. That wasn't like this lifelong goal that I had.
Yeah.
I, yeah, I started when in my undergrad education, I became a yoga instructor. I got all these yoga certifications. I started teaching classes and fell in love with just instructing movement and helping people in their body. And I was so interested when people would come up to me with, I have this pain, this problem, this thing, and I just wanted to know more. I wanted to figure it out and be able to go
Yeah.
beyond just, yeah, the yoga world. So got into PT school. And eventually, we ended up taking a class towards the final year of PT school in pelvic health, both men's and men and women's pelvic floor health. And that was like this entire just world opened up because it took all of these pieces I already loved, movement, breath work, nervous system, pain issues,
Yeah.
and putting it in this much more kind of unique sphere of helping people with problems that they don't typically talk about, just in their day-to-day lives. And I
Right.
love being able to help people navigate through challenges that are maybe really manifesting in their lives as a big problem. I wanted to be able to dive into topics that felt really uncomfortable for people to share and help them feel more confident and comfortable in their bodies
Yeah.
and learn that, yeah, within that sphere, we can help women who are pregnant, women who've given birth, women who are going through menopause, men who are struggling after prostate cancer, kids who are struggling with chronic constipation. I mean, it kind of
Yeah.
goes across the whole board.
And why do you think? So in my own home, we had some of those issues going on and went to the regular doctor several times looking and seeking answers. And we're really not given any information on that. Why do you think that is?
Yeah, I think there's a lack of general education. I mean, even most physical therapists aren't really given this education
Right.
on
Yeah.
pelvic health when
Right.
it is just another muscle group in the body, just like your
Right.
biceps or your glutes or your
Right.
shoulders, right?
And
It's really.
a pretty major one that's in charge of a lot of things within our body, right?
Oh yeah, yeah, like major functions, right? We poop, we pee, we
Yeah.
do things all day with our pelvic floor and don't even realize it.
Right.
And so to me, it's like that should be maybe one of the first things we all learn about and understand about our bodies. And so I don't know, I think it's attached to a lot of things that are more taboo, from things like pooping, peeing, intimacy.
Right.
It's not things that we just talk about all day, and lack of education across the medical sphere.
Right. I love that.
Yeah.
Okay, so one of the things that I've learned along my journey is how important the pelvic floor health is in relation to the vagus nerve. So, for those of you that are listening and aren't sure what the vagus nerve is, it's the major nerve that connects your brain to your nervous system, right? So if it's not functioning properly, your nervous system is probably going to be a mess. So I talk about the vagus nerve a lot, but one of the things I've learned along the way is your pelvic floor can be directly tied to that. So why don't you just touch on that for me, Hannah?
Mhm. Yeah, so I'm gonna kind of take a little journey through this a bit because I too love the vagus nerve, and we often
Yes.
weave in a lot of vagus nerve hands-on techniques in our clinic. Like we'll
Yes.
literally do work on people's bodies that help stimulate the vagus nerve, help get it to wake up and work
Yes.
better.
Yep.
But this is kind of an interesting study that was done. I can't remember the name or when, but our pelvic floor is so intimately connected to our nervous system. And a lot of the folks that we work with are struggling with things like chronic pelvic floor pain issues,
Hmm.
tension problems, bowel or bladder dysfunction, pain with intimacy, all sorts of just not fun pain based
Yeah.
disorders and issues. And there was this study that was done where they had women sitting in a room. I think they had like EMG sensors or something on their pelvic floor muscles,
Yeah.
watching scary videos and different, sensing different muscles in their body.
Yeah.
And what was found is that the pelvic floor like went into this like gripping tension pattern before any other muscle group in the body. So it
Mm.
responds intimately to stimulus in our lives, stress, anxiety, fear, nervous system upregulation. And
Yes.
so we can have these chronic tension pain patterns that are manifested out of a nervous system dysregulation problem.
Yeah.
And as a pelvic floor physical therapist that works from a much more holistic lens, meaning I'm not just like, hey, this muscle is tight, let's poke at it, let's massage it, let's make it
Right.
better, going deeper, peeling back the layers to really understand, but why? Why is it like that? Why has it been like that for 5, 10, 15 years? What is the root cause that has created this pain problem, this manifestation it is today? And usually it's like once we start digging in, having more conversations, peeling back those layers of these like deep rooted nervous system upregulation issues that maybe came
Yes.
from childhood, came from young adulthood, whatever, some big traumatic event in someone's life, that's when these problems arise. And so, and it's not always that dramatic, right? It can be these slow build
Right.
issues that
Right.
build over time. But what I found is the majority of the time, we we have to go into the layer of the nervous system. It is not just about stretches and yoga positions and breathing and hands-on, massage work.
Yeah.
It's the nervous system. That's
Yes.
that's what's going to help us move forward. And so if we can teach our clients to have like very tangible strategies and tools like certain breath work techniques, vagus nerve hands-on techniques to the neck, to the belly, mindful progressive muscle relaxation, different meditation options, like so many, those are just like a couple of the
Right.
wide breadth of tools we have, but we have to go to the vagus nerve. And the other really cool thing I like to educate my clients on is the pathway of the vagus nerve. So sometimes I'll even take like a long TheraBand or a wire, and
Yeah.
I'll be like, it starts here, kind of up at the base of your skull,
Right.
comes down the side of your neck, and that vagus nerve then goes to your heart, to your lungs, and
Yep.
all across your GI system.
Every single major organ it touches.
Yes, it touches everything, right? And
Yes.
so if we think about like if you have a lot of cranky neck tension and your gut health isn't super happy, you're not, having, healthy bowel movements, right? The whole thing like that, those are little signs of vagus nerve dysregulation.
Yes.
And so we have to go into treating that vagus nerve from the top all the way to the bottom. And because we're physical therapists, our clinic prioritizes, hey, we know that that's probably a problem, so let's do techniques in clinic. There's a lot of cool things we'll do with you on the table, working around the tissues of your neck, your shoulders, your sternum, gentle manual therapy or manipulation to the GI organs
Right.
to help bring blood flow to that vagus nerve. And it's amazing when you start doing some of this work. I'll just see my clients. It's like they just take this deep exhale. It's like they soften,
Right.
like
Like their
something.
whole body just like lets go of that bracing.
Yes, yes, exactly. That
Yes.
full body bracing. And
Yes.
if you're constantly in this brace across your whole system, your pelvic floor is going to come along for the ride in that.
Yep.
Like it's going to not be happy. And that's where I, as a physical therapist, my very baseline training was, treat the tissues, treat the bones, treat the joints. But it's like that's like layer one. We
Yes.
have to dig deeper. What's happening at the nervous system? If we can go
So
there
good.
through our hands-on treatments, through the tools we provide our clients, that's when we can start to get to that longer term resolution.
That's so good. And I don't know about you, but like I do a lot of those same things. I just have a different approach. But like where a lot of my clients come to me is when they've had trauma, right? They've had that
Yes.
severe trauma and they've tried, talk therapy, they've tried other types of therapy and they're like, I just can't let it go because we know that the body holds on to everything. The physiology holds on to that trauma. And so I love what you're saying about all the layers, right? Because it's not
Mhm.
just a physical issue, usually when you're having pain, especially when it's been long-term chronic pain, you have to
Yes.
involve the nervous system in order to just really peel back that. So good. So good.
Yeah.
So let's talk about one of the things I've heard you talk about before is men's pelvic health, which is just absolute. Women's pelvic health is not talked about enough, but I've never heard
Mhm.
men's pelvic health talked about until you talked about it. And I'm at that age where, I have a handful of friends that have been experiencing prostate cancer. And so talk about men's pelvic health for just a moment.
For sure. So, our pelvic floor muscles are really like the actual muscle tissue is pretty much the same across men and women, right? We all have a pelvic floor, but
Right.
then things change from kind of the genital space and all of that. Of course, there's
Yes.
differences there. But long story short, anyone that has these muscles can have a problem with these muscles or
Yeah.
anything
Yeah.
connected to them, right?
Mhm.
So for men, right, just like women can have a bunch of problems, they can also experience a wide variety of issues. So some of the most common things that we see in our office that men come in for, one of them is you mentioned prostate cancer. That's a big one. So
Right.
a lot of men, I mean, usually we see that in kind of the older population, but we can have younger guys who unfortunately experience prostate cancer as well. So that prostate organ needs to be removed. And during that process, in order to remove that tissue to make sure we get the cancer out, the individual can start to experience a lot of urinary incontinence and leaking because that prostate helps kind of guard the urethra from leakage. And then a lot of erectile dysfunction issues because of the damage to some of the nerves to that erectile tissue. So there's a lot of things that we can do in our office to help with different pelvic floor strengthening, breath work exercises, things like that. It goes much more in depth than that. But
Yeah.
long story short, to help men kind of reclaim their lives again, because it can be
Yes.
very, very damaging emotionally, actually, after that kind of experience. I mean, you had cancer and then all of these repercussions afterwards that you had
Right.
no control over.
Right.
Some other common things are, chronic constipation issues, straining problems, testicular pain. I mean, something that a lot of the men we see, they're not telling anyone. Sometimes even their own spouses or partners don't even realize the extent of
Right.
their pain. And things have been ruled out medically, and so it's usually a combination of nervous system, tissues and muscles that are tight and angry. Usually, once we start to dig beneath the surface, there's some type of trauma pattern that happened at some point. Believe it or not, a lot of our male clients are police officers, military, or like high level executive type folks who are dealing with a lot of stress in their
Yeah,
lives.
that actually makes
And
sense to
these
me.
Exactly. And a lot of these things are manifested and born out of that.
Right.
Um,
People don't
so
realize how
it's
much stress they hold in that pelvic floor, right? So when you're constantly under stress, then it starts to manifest out and have deeper chronic issues. Yeah, so good. What about
100%.
what about women? So let's talk about women. So most of the time, women are not educated at all on pelvic floor health until after childbirth. But I know that there's all kinds of other things that can be happening long before that. That's just when symptoms can tend to get, chronic or people start to do things about it. So talk a little bit about women's pelvic floor health.
hmm Yes. So for women, I like you mentioned, a lot of times the conversation is born out of, oh, I had a baby, right? Now I'm having all these issues. But if
Yeah.
we just set that aside for a second, our pelvic floor is interconnected to so many other aspects of our body and our lives and our movement. And so for people who've never had children before, we help people who have been struggling with things like tailbone pain, endometriosis problems, chronic constipation and bowel health disorders, low back or hip pain that's never been resolved because we're not tapping into the root cause of why that's even showing up. And usually it's
Hmm.
some sort of pelvic floor and nervous system issue. And so those are just kind of a list of symptoms and problems we help with, but that's like children or not, like we can have all sorts of issues throughout our entire lives.
Right.
And then, of course, we've got our pregnancy postpartum sphere. Women who are pregnant, I mean, man, your body is changing so much from trimester to trimester. There are things that we do, even if people aren't having pain or symptoms, to help you prepare your body for birth. So, hands-on
Mhm.
body work, birth prep exercises, mobility drills, things that you can do to set yourself up for success for birth and postpartum healing, and helping women rebuild their strength and confidence and healing after having a baby. I don't
Yeah.
think we give enough attention to just how much that impacts I mean, every aspect of our
It
lives.
really, really does. Another issue I want to talk about is when I first started learning about pelvic floor health, I was stuck in the middle of my chronic health issues, right? And what I would have is I'd have a neck and shoulders that were totally braced and inflamed. And what surprised me is after trying chiropractors and all these other things, and I would get temporary relief, somebody finally said it's actually your pelvic floor because your pelvic floor is so weak, your neck is having to like take over and hold the weight of your core. So talk about
Yes.
that a little bit because I had migraines
Yeah,
for years until I got help with that area.
totally. So, just imagine even in your mind right now, your body being stacked, right? So you've got your feet, your pelvis, your spine, your neck, and then your head. And there are tissues around your core canister. So think about your hips, your glutes, your deep core, your pelvic floor. That's what we call your core. It's like this whole system of muscles. It's not just your abs that need to be doing their job. It's like the middle of your body.
Yeah.
And if there's something happening at one of those muscle groups, like your core is really weak. And again, that could include your pelvic floor, your back, your hips, your glutes, all of those things. Other parts of your body are going to have to compensate for that. They're going
Yeah.
to have to take over the work that those other groups aren't doing. And so a lot of times we will see, and this is why, as pelvic floor therapists, at least at Awake Pelvic Health, my clinic, we're not just pigeonholing our attention into those muscles.
So
We
good.
do work with people, for example, with chronic headaches or migraines, upper back problems, foot and ankle issues. They've never had resolution. And so, what we're looking at is that whole body system because it's probably something up or down the chain that's actually the real root problem that is causing these chronic head, neck issues or what have you, right?
Yeah.
And so then we can look at, okay, how are those muscle groups of your pelvic floor actually working and doing their job? Oh, they're not. Let's go there as we continue to work up and down the chain, if that kind of makes
Yep,
sense.
so good. I love it. Okay, talk about bedwetting in kids because I know a lot of sensory kids, a lot of kids that are just struggling to regulate, and we're seeing so many of those as these COVID babies are getting older, even more so than we ever have in the past. Talk about that a little bit and how that all can be connected.
For sure. So I will say my expertise is not in pediatrics, but we do treat peds at my clinic because we have a couple providers who are just absolutely brilliant. But from a just kind of a very basic level
Yeah,
foundation, when we think about kiddos and bedwetting and pelvic floor issues, usually it's not like, oh, my kid has a weak pelvic floor, right?
right.
It's typically there's more to the picture, such as helping educate parents on daily habits, hydration, food intake, constipation problems. So if a little kiddo is having bowel issues or constipation issues, that's going to put a lot of pressure on their little bladder, and they're not, they haven't quite learned, really true like deep body signals like
Right,
adults hopefully have.
right.
And so when we're looking at kids that are kind of chronic bedwetting, and sometimes we've even treated, peds who are in their teens with this
Right.
issue.
Hmm.
And so what we really do have to look at is this very holistic pie of kind of like any sort of past trauma stuff that's playing a role, nervous system upregulation, hydration and nutrition habits, movement, bowel health, right? All those pieces to the puzzle
Right.
are what we need to look at to figure out why is that happening. So it's usually not like just a one root
Yeah.
cause problem. It's like multifactorial.
Right. And I don't think people associate pelvic floor health with kids at all. I just know in my own home that that was a big issue. And until we address the pelvic floor, the bedwetting didn't stop. So it's been
Mhm.
life-changing for our family. So I'm just super thankful for that. Any
Yeah.
last thoughts about pelvic floor health and nervous system regulation that you want to share?
Yeah, I just, I'm sorry, my voice is getting a little scratchy. I think I just want people to recognize that the issues that can come up with someone's pelvic floor is it's not weird. A lot of these things are common but not normal. And if you've been dealing with some type of chronic pain pattern, some type of thing that you're like, wow, you know, I, I've been dealing with this for a long time. I finally want to get some resolution that there is help out there and there are
Right.
solutions for you and that it's not something you just have to live with. So that's kind of the
Yeah.
message I'd like to get out
Yeah,
there.
that's so good. And so Awake Pelvic Health is located in Woodbury, Minnesota, but I know I have listeners all over the world. So if somebody's looking for a pelvic floor therapist that's not local to our area, Hannah, what would you say the things to look at? Because I've been to several, right? And they're not all the same. So what kind of things
Mhm.
would you say they should look for if they're looking for a practitioner?
Yeah, yeah, exactly. Just like any medical provider, everyone is different. So the things that I really encourage folks to look at and ask questions on before they head on in is, how long are visits? So I really do believe that a good full hour at least is important so we can look at all of the different pieces to the puzzle. Is that person, do they have a specialty in pelvic health, or is that just kind of
Mhm.
like a little thing they do on the side? And
Right.
do they believe in and treat from a holistic whole body lens? Meaning,
Yes.
if you're going in with a problem like urinary leakage or incontinence, are they just looking at your pelvic floor and maybe doing some biofeedback or something like that? Or are they looking at everything up the chain from how you're breathing, how you move your body, what's happening in your foot and your ankle? How is your nervous system? What's your stress look like? Like all
Right.
of those pieces are important. So those are the things I would be looking
Yes,
for.
that's so good. That's so good. Well, thank you so much for being here today. If you want to connect with Hannah, I will put her contact information in the show notes. So feel free to do that. I just appreciate your time and I appreciate the work that you're doing. It's super important.
Yeah, thank you. And likewise.
Yes, thanks so much.